Welcome to Dr. Arthur Fedorowski, Senior Consultant in the Cardiology Department at Skåne University Hospital, and also Lund University Hospital Department of Clinical Science, based in Sweden. Welcome, Dr. Fedorowski, and thank you for addressing questions posed by patients on syncope.
Oh, thank you for inviting me to this session.
Some people with bradycardia, slow heart rhythms, go on to have a pacemaker. Should people with syncope receive a pacemaker, or is it just a certain subset of patients that would receive a pacemaker to help their symptoms?
The general rule is that you have to see the bradycardia or too slow heart rhythm to decide on pacemaker. So first we have to document that the syncope is really correlated with bradycardia or too slow, heart beating too slowly. So this is the first step. Then, as we mentioned before, if this is an isolated cardiac arrhythmia without vasovagal reflex, then the treatment is very effective. When there is vasovagal reflex in the background, then you should treat both arrhythmia and the heart rhythm or too slow heart rhythm and blood pressure fall, which usually accompanies heart rhythm disorders. So there is quite a huge subset of patients requiring pacemaker, and the pacemaker treatment is very, very effective.
Absolutely. In the patients that have pacemakers, for the majority of them, it prevents the loss of consciousness. One thing it doesn't necessarily prevent, which patients are always surprised at, they may still have that lightheaded feeling before the pacemaker clicks in, but what it actually does is stop the full-blown loss of consciousness. So it is very successful.